Hello, everyone. I hope happy Friday. Hope everyone's having an amazing day. As always on a Friday, we get to meet and talk a little bit about what's going on in the industry and what's happening. And today luckily is a Friday, so happy Friday to everyone with us. Hi, Patricia. Always good to see you with us. Um, Today, we chose to do something a little different than usual. We're going to have a discussion by everyone on, a lot of information based on our conversations with the offices. And if there is um, a thing that comes up again and again in our conversations is what are the other clinics doing? And I think we're going to talk a little bit about that today throughout the broadcast. And we are going to probably start, kind of in order of geography, I guess. We're going to start with Mike. Um, Mike is going to talk about his region, a little bit about his conversations with the clinics in his region, and he's going to share more about what we learned and some questions that people are asking.
Thanks, Alex. Hey, everyone. I hope everyone's having a good week and looking forward to that weekend coming up. Myself, I cover the eastern region of Canada, so that's like the Maritimes, Quebec, Ottawa, and the GTA of Toronto. And a lot of what my conversations with clients is about planning, whether it's planning for things to be added into the clinic to follow all those regulations, or if they're just planning to reduce some of those touch points by adding some more technical computer programs and such. Things such as like digital charting and patient reminders, those kinds of items. And really, the one thing that strikes me with all those planning is that they reach out and it's very last minute planning. So when I say that, it's where they're thinking in about 2 days to have it implemented and to be live with, say, digital charting or something of that nature. And what I really wanted to highlight was kind of if you are planning to do something like this with your clinic and you are looking to do that upgrade, it's always best to give about a week's time to get everything going. Just a lot of scheduling and getting the ball rolling with multiple parties. It does take up a lot of time. The biggest time consumers, I would say, would probably be where it comes to scheduling, as well as doing some training, and then the technical implementation of it as well. Those are the three items that would take up the most time. So what I've learned from having these conversations is I think it's best that offices think about a week in advance as to what they would want to put into the office, how they would want to reduce those touch points and communicate with their patients more efficiently. And then with that, then they can reach out and kind of get that ball rolling, as the results will take some time to be implemented and it won't be coming right away. And that's a large portion of the conversations that I've been having with my clients across Eastern Canada. One other thing that's been up in conversation too with clients is our graphic design. So as Alex had mentioned in our last webcast, we do have a new graphic design section available now. And with the clients that I've been speaking with, a lot of them have been asking about things such as like an adhesive floor decal or an A-board. And for those of you that don't know what an A-board is, as I was someone who didn't know that either, it's those boards that sit outside of the restaurant when, say, you're walking down the sidewalk, and it provides that kind of like an infographic of information, or as you see with restaurants, they would put like daily specials and things like that on there. So that was mainly being sought after for getting like infographics and things like that can be put on the outside of the clinic, and then patients can see that as whether they're driving by or walking past. So one question that I was asked is what's all included with that graphic design service? So with that being said, when I say what's all included, is that the graphic design service produces the graphic that is going to be applied to those. So they won't be able to produce the A-board, the actual structure itself, though you can always connect with Vistaprint and get specifications from them, in which you can provide to the graphic design service, which will then provide that graphic to apply to that frame. And so it kind of goes hand in hand there. And then another question that I hear as well is, what work is expected from the office? So I have had a few clients that had reached out and they had mentioned that they are very focused on getting everything up into the clinic and getting the clinic completely up to date when it comes to all the different things that they're looking to implement. And I do completely understand that takes a lot of time. It's not easy to focus on all that, as well as building graphics for the clinic. Though the nice thing is with the graphics design services, it's posed a couple of questions in which you give your feedback on, and then from there they will go ahead and produce a proof copy, and then from there the clinic will be able to continue those revisions and keep playing around with it. It really doesn't involve any effort on the office's side. It's more of a conversation saying, you know, this is how I feel from that design, and this is what I feel would look a little bit better on that. And then they would send it back and get it kind of reworked. So those are really what my conversations have been based about for Eastern Canada, and just kind of how to get that all implemented in a timely manner. So that's it for Eastern Canada.
Awesome, thanks, Mike. And yeah, for the graphic design component, I think a lot of people, at least that I spoke with, would be asking me, so, you know, Vistaprint has those adhesives of where to stand and, you know, wash your hands kind of things already made up. So why should we have someone design it? And the answer is, well, it all depends on your clinic, right? If your clinic is not focused on the brand, then you should probably not do anything that is designed with your branding. But if your clinic is high on branding, then any piece of communication needs to encompass your brand. It needs to have a logo where necessary. It needs to have the theme and the colors and the feel that it is consistent. So, you know, that those are the situations where you would like to have it branded to just provide a consistent experience to the patients. So again, that's that. If you don't have a logo and you have sporadic, you know, non-branded Word documents with some content and information for patients glued on the walls around the clinic, then maybe you don't need, you know, some branded graphic design. But if branding is something that's important for you and a consistent experience for the patient, then you should definitely make sure that all of your documentation is branded properly. So, you know, that's kind of my 2 cents. Moving along through the absolutely stunning geography of Canada, and moving more to a more central location, Jay is here to share some of his conversations and trends throughout his region and clients.
All right. Well, again, thank you guys for watching and being with us. Happy Friday to all of you. Now, yeah. So as we go on to the updates, I'm specifically handling Manitoba and Ontario, the rest of Ontario except GTA and Ottawa. So I'd like to give a feedback. Majority of the conversations I've had was with Manitoba, a few from Ontario offices. Now we are opening on for the second phase on Monday, and a lot of the conversations I've had has been, like they're excited. A lot of them have things in place, like the staff has been oriented. So the dilemma, I don't want to say the dilemma, but then maybe the challenge is just for it's half and half. Like for some offices, they're thinking of how will they get patients back, but right now we can't really determine that until it happens, right? But majority of the offices because we've offered the free e-blast, a complimentary e-blast for our offices, and both our clients and non-clients, and we got a really good high turnout on that. A lot of people took advantage of that, and basically that's what I've been doing almost all week. I guess it's the same for the rest of the guys here. But it's good. I mean, that's the only. That's one way for us to to provide help to our clients, and that's communication. And we're so big in communication, and especially in this time, a lot of offices are communicating with the patients on what to expect. There's this one office that's the challenge. They're excited for the opening, but what's stressing the receptionist that I was talking to, what's stressing her out was, okay, well, like just the process, just thinking about the process of, because they're situated in the building. So like she said, she has to go down, and like I didn't go into the details of why she has to go down and pick up the patient from the car, but then she said they don't have a waiting room. So she would go down and pick the patient up and walk her to the office. Now the only thing I'm thinking there is that, okay, maybe the office, the building that they're renting is has certain rules that nobody can just come in without the consent of the people renting out in there. So that's the only thing. So yeah, just that fact that doing that before, you're just sitting down, and then now you have to like do all that exercise. Well, it's actually, I guess it's good in a way, because we know. I mean, I've experienced that. If you're just sitting there and behind your desk, you would you may gain a little weight, and I've I've experienced that. So that's a good exercise for some. And then for a lot of offices, I've seen that they're now utilizing. I know we've mentioned this a while back, that a lot of them are utilizing social media for their campaign, in educating and informing the patients on what what they're doing. So I like this. There was this like the ad from this doctor. He said he didn't have time to do all these marketing stuff before COVID, but now he's actually liked the fact that he's get to focus on the things that was being neglected, and one of them is marketing. So now he has he's doing an amazing like campaign with their reopening, telling the patients they have actually reenacted what and showed the office on what the patients need to expect in terms of safety precautions and what they need to do. So that's a good thing. And but on the other hand, for Ontario, it's like I'm getting a little like it's different. Manitoba's excited. Ontario is excited and scared because they said, just like reading the news earlier, from I don't know, CBC or CTV, that they said that the regulations that was placed by the college and public health is totally different from across the country. Now I've had the most stressful thing is not really, before it was like we can't get a hold of PPE. Like I don't know when I'm going to reopen. So that's done. That part of it is done. Now it's the actual now that they're reopening. It's the actual guidelines, because I've heard from this one office, when SARS happened, long time ago, like they said they had this situation that where it would be recommended to do this, but yet like if something happens, then you would the public health would actually do a thorough investigation until where did they go and all these things, and then now, well, it was recommended. So now like they're afraid to not actually implement the recommendations. And I know like it's different. We've been discussing that all the time. Like what's the recommendation versus the what's the directive. But then now, even if it's recommended, I mean, you still have to do it because later on, if something happens, well, it was recommended. So they're scared of that, and yeah, so it's really it's really a challenging situation, and they can't really tell what it is. Now, the only thing I can say is the common ground is aside from the actual procedures. I know we've talked about this like almost every week, but I just want to reiterate the touchless and like touchless process of what these offices are implementing. Now, this is just fresh. This was just earlier. There's this one office that want to implement the COVID questionnaire, and it takes time and then this is just a specific scenario where you never know if it's just going to last for 6 months or 1 year. Then it may not be it may not be relevant anymore. So like actually putting that form in and coding it in our software Maxident would it will just be like maybe I don't know, maybe a waste of time later on. So there are ways in our software to actually input those questionnaires, and the good thing is that it's compatible with a tablet. So if you're thinking about touchscreen or like less contact, then that's a good way to to go about it. Is not just sending, because for some offices I've heard they're going to email it, the patient will send the form with them, and then now what are you going to do with the form? Like you're going to scan it and then file it, and then yet these are all contacts that you're doing, right? Physical contacts, where like if it's just a tablet, you can just easily wipe it off. So I guess that's where we want to go now, is how to be creative in doing the normal things that you're doing in the past, to make it less of a physical contact. So yeah, those are the conversations. I'm excited to hear what our clients are going to say, especially in Ontario next week as they slowly reopen. So yeah, so tune in and see how these other offices of ours are doing. All right, that's it. Thank you.
Thanks, Jay. What a great spoiler for tune in next week and learn the fate of our offices in Ontario. But yeah, so I'll touch on this, on the challenges around reopening a little later. But you're right, we are seeing quite the awakening throughout the country with regards to taking action, specifically communicating with patients. So, I don't know if the entire country has been watching our broadcast here, or maybe we're not the only ones who are saying it, but communication, and another time communication with your patients is big, and we have been seeing a lot of offices implement these, so we are extremely happy with that. Although they do have some different messages inside, but whatever the message is, if you communicate it to the patients, you are already on the right track. So that's awesome. And this is how we go down to the West Coast, where it's not as sunny and it's rainy and expensive, but people still love it to death. So James is going to cover some of the Western region, and I guess some of the prairies too. So you get the advantage of both.
Yeah, thanks, guys. No, even though it's could be sunny, rainy wherever on the West Coast, still home to me. So just to kind of say something on Jay's part there when he was talking about exercising, reminded me of a spot last night. I was kind of laughing to myself for a sec. So every day when I work out down in the basement, I always play this game called musical roulette, and I literally just press play on my phone and just hit random, whatever comes up, right? So normally it's a little bit more heavy stuff when I'm doing exercising, but last night, all of a sudden, The Edge of 17 by Stevie Nicks came on, such a classic song. And here I am rocking out, and then there's one line in the song that says, the sea changes colors, but the sea doesn't change. And it's very true, just to how life is right now for all of us. And just to kind of touch base on what Jay was saying there too, in a few offices, it seems like the anxieties that are built up around reopening right now are almost like when we all got our first job and you have that first day jitters, like, are people going to like me? Are people going to yell at me today, kind of thing? And I think that that's for some of the admin staff who have to do and help out, where you were saying, like, may have to go down and open the door and get someone from their car and stuff like that. Everyone just wants to make sure that they're doing it all in the most safe and right manner. And of course, you don't want to break any sort of trust or any sort of protocol. But again, you have to remind yourself that at the end of the day, this is just still what you do best, right? Still having that smile, still having that confidence, and that care factor behind, what you're doing. And especially going through this protocol, because it's new to everybody, is going to equal trust with that patient again at the end of the day. And it's going to show a lot of comfort, not only for you and your staff around you, but for the patients as well. And I think that's one key thing that we have to keep in the back of our mind, that you're doing everything that you do best. All you need to do is smile and just show the care, right, of the process. Mike touched on a good point too with marketing. I think even though right now, if someone started thinking about marketing, I don't know if that's the greatest timing for themselves because of all the other things that are going on. But I've had a few soft conversations over the last month with offices who started thinking about what their brand was going to be going forward. And after the first few stages, when everything goes back to being reopened, how is that going to look for them, and how do they want to position themselves in the marketplace? So this came about this month with the graphic design and what we're now able to offer. So I know that I'm going to be going back on a few conversations over the next month. And again, from all of us, we invite you to definitely join in. If you have any thoughts and ideas or things you want to do down the road, we can always start those planning stages with you now. And get you to have a better idea of what you want to do going forward. A ton of calls just over the last week are things of more last minute nature, and to kind of touch on what Mike was saying before, sometimes there's a how can I put it? It's a unknowable expectation on both ends. And I'll put it to you this way: the office calls, they're just opening up. We haven't really been able to get in contact for the last little while, just due to the closure. And now everyone wants everything done as fast as possible. And unfortunately, there are scheduling things that we need to do to make sure that we run down our checklists as well and make sure everything's properly in place. I don't think that this is a time for anybody to do sloppy work. So we don't want to be doing things where we don't have a good scope on what we need to do. And that's a good focus for us and a good focus for you. We will help you through any short-term issues that you have or challenges that you have to make sure that we can support you just as we always do. But again, at the end of the day, you want to make sure that if we need to have communications, please do so. I've had a few calls of some offices now exploring software changes as well, and what that may look like for their office. So those calls are always ongoing, but it's good to talk to the dental community, even outside of our own family, in the sense of finding out what their needs are. So it helps prepares us for anything that we need to offer. And again, to show how we are a leader in our own industry as well, based on the brand positioning that we have, the community, the testimonials, and the fact that we have a care factor behind our product. which I really find is nonetheless from anybody else. I've had some shorter convos this week on our integration to SecureSend, which is, a big thing that we are set to announce here soon. And starting to plan for that in our future updates to make sure that the offices are updated with everything that's current, and knowing that that's a part of it, and we're making sure that all offices have that available for themselves, is again making sure that we're taking care of our family and the community around us as well. And it's been an interesting conversation in some of those new software exploring offices that we're talking to for kind of like on a new lead scale. That seems to be a big interest factor with them as well. So I've had a few longer conversations over this month, actually, with numerous offices. And one of the biggest challenges is I've had more than a few times where I get on one call, I get back-to-back calls, and then I get off my phone and my voicemail is completely full, just because people are all trying to reach out at once. But it's good because it shows that people, again, are opening up, and they want to make sure that we're having some sort of conversation ahead of time, to make sure that, again, you should always be in sync with your account managers and with your software vendor, to make sure that relationship is always strong at the end of the day, and that you're being taken care of. And if anything has changed, i.e. just because the office has been closed and had downtime, you've had different thought patterns and different anxieties that you're thinking about. Well, on the software end of the spectrum, we keep doing updates, we keep fixing things as we go along. So we want to make sure that you have that ability to have all the enhancements that you really need to go forward and be successful with as well. I had a great longer conversation with a doctor this week, who I know a few of you may have certain insurances that cover pandemic coverage. And a chunk of it was making sure that we get the right reporting over to you, so you can provide that paperwork to your insurance provider with confidence. And one sort of thing that came up that I didn't really think about, and this is why I like these sort of challenges and these conversations, because it always makes you think, oh, someone else is going through this. Well, I bet you 30 other people are probably going through the same thing. Is that obviously when you're closed, and if you don't have, the admin doing postings and closings every day, your posting dates, when you go to do your drop down, may look out of whack, because something you may have posted in April and now you've posted something in May, but those are the only two posting dates that are showing. So before you panic, of course, give us a call, or give your software vendor a call, because there's other ways that you can get those summaries as well, just by going through calendar dates and things like that, to make sure that you get that proper scope to your insurance provider. And again, we want to help you get through this as comfortable as possible. And if there's anything that we need to do or connect with you on, we're here to do that as well. But the primary conversation, the big long conversations over this month, is Maxi Reminder, more than anything else. And it's making sure that the office has patient communications. Now, we've also talked about here the free e-blast that we've been providing. And it's really, I've seen more of a surge of offices that don't have a patient communication system that are taking advantage of this versus the ones that do. And we've had a few offices, even with patient communication, that want to send a specific different type of message out. And we're able to do that for them and help them out with that as well. But it shows a need right there with the amount of people that are reaching out to us and putting that together. That there's a need. So I know all of us here will open the door to any conversation that has to do with enhancing your lives further to be more efficient in any way possible. So please give us a call if the patient communication thing, because it's critical. Like at this point, it's a must-have for all offices. I truly believe so. And the fact that we can even do that 30-day free trial, like right now is the time to set all this up and get this going for you. It's just another benefit to making sure that you have the tools available. And I can guarantee you, after that 30 days, you will see the value in what it can do, and how much more your reach is, and how much more efficient your office is going to be, because there's other areas right now that you're going to have to concentrate on, and making sure that these seats are filled during this time period, even though it's one at a time, two at a time, however your office dynamic is set up. You want to make sure that that you're getting the most out of your time. So that has generally been everything over the last month. I found a really cool article this week on electro PPE that's now being developed. It's simply just a new way. It was done by Forbes. I actually have it up here. New research shows electroceutical fabric eradicates coronavirus infectivity on contact. And basically, just in a short summary here, it says last month a team of researchers determined a hybrid combination of 1 layer of cotton and 2 layers of chiffon is the most effective fabric for face masks. They noted the high efficiency of the combination is likely due to the combined effect of mechanical and electrostatic filtration of infective particles. So this technology isn't new. They've been doing things like this with electroceuticals for years. But when it comes to the topic of trying to get us even further past where we are now and to stop the spread as much as possible, it's really encouraging to see articles like this, because it just shows you how it's not just a vaccine that they're trying to develop. It's everything else that they can around the clock too. So yeah, with that being said, that's a chunk of my time and what's happened on the West Coast.
Awesome, thank you very much, James. And yeah, it's interesting to see that although there are different guidelines and different dates for reopening, that across the country we're seeing an awakening, and people are starting to think about what they need to do now. Like Mike mentioned, a lot of times they remember that in stoppage time. So, but yeah, at least thinking about it and being aware of things that need to be done is extremely important, and we welcome all of these conversations, and we'll try to accommodate any requests that can be made. So I'm personally very excited with having reopenings. I am in extreme fear of a second wave that potentially is going to drive 10 to 20% of businesses in the dental world probably into the ground, just because the people who barely survived the first wave would probably not survive the second. So I'm really crossing my fingers and hoping that there won't be a second wave, and none of the articles about the people of Ontario and Toronto specifically that are not observing social distancing is any type of reassurance. But it is what it is, and we're going to have to deal with what's going to happen, and hope for the best. So we talked about dental, but there is a big group of denturists and independent hygienists out there that have been struggling similarly, if not more, with the closures. Being smaller operations, and obviously without being classified for any type of emergency, they've been seeing a complete stop and halt of their business. But Noel has been in constant communication with all the people, and had his ears burning, not only from the from the phone, but yeah, he's going to share some information with regards to what are the hygienists and denturists saying about this whole situation, and what their feelings are, and everything.
Thank you, Alex, and good day to everyone. Thanks for tuning in. And I'd like to share the conversation with a number of hygienists in a denturist office. and for the past few days. And one of the so they are excited about reopening, and at the same time, the main question there is, do they have enough supplies or PPEs? Um, some of them have 1 week of supply, and some of them don't have enough, don't have the PPE at all to use, and that's prevent them from reopening their clinics. And we also have discussions on what was the cost of the protective equipment, in particular with gowns, wherein before you can get a gown for $10 a piece or cheaper, but we know how much the gown costs today. And the question here is, if what will happen to the, or how will affect the offices and patients when it comes to cost of the treatments. And I think it's a good idea to have the discussions with the patients about the total cost of treatments, including PPEs, and make sure they fully understand and acknowledge the cost before the treatment starts. And I know you can, in the Maxident software, you can add a PPE as a in-house code, as we call it. And I'm sure you can do that as well in other practice management software. And the insurance company have not covered the PPE before. And I'm sure they are rewriting the policies. And they started rewriting the policies and to include these PPEs. And I'm sure this will have a tremendous effect as far as the policy costs and renewal for next year. I know the DAC, as well as in coordination with CDA, as well as I think the ODSA is involved with communications with the insurance as to what is the next step into the PPE as far as the policy is concerned. And I think it's a good idea to get everybody involved, including the other colleges, to get into discussion as well. All right, and that's it for me for today. And you have a good day, everyone.
Awesome. Thanks, Noel. And yeah, it's the thing with PPE is extremely awkward. There are a lot of people out there that are anxious, are afraid of what reopening is going to look like, specifically for their jobs. And that kind of leads me into at least one of the topics that I want to talk about. So if you are familiar with the acronym FOMO, fear of missing out, this is mainly has been developed or coined on the rise of social media, and I read in one article that fear of missing out is responsible for most car accidents now, due to that feeling of missing out, actually not forcing you, but pushes you to check your cell phone and deal with your cell phone while you're driving. So it's a real psychological issue, right? But with speaking with a lot of dental staff and even dentists, and reading through a member survey that I've seen for Hygienists in BC, I want to coin this acronym, FORO, fear of reopening. This is what we're seeing right now across the country. So remember where you saw it first, but this is a real deal. Surveys show that about 70% of hygienists are afraid to come back to work, specifically in BC. BC has, one of the more lenient guidelines when it comes to, infection protection and control. So the fear is, partially because of that. When you look at Ontario, I haven't seen any official surveys there, but from the conversations it seems that the biggest complaint there is that the guidelines are too strict. So, wherever you go, you see people complain and fear, and one of the reasons is because it's the unknown. I think that everyone who works in a dental clinic needs to understand that although they are not the hospital front lines, but because they are in the healthcare industry and they are providing medical services, they are to an extent on the front lines. And people say that right now we're connecting cardiovascular disease and things like that to oral health. So as the profession that is responsible for patients' oral health, this is the front lines. And I think you need to understand that when you are choosing this profession, you are choosing to put your life in a situation where it is higher risk, than people who are, I don't know, software developers or whatever else. I think this is something that you need to be aware of. I spoke with quite a few dentists that were telling me that the increase in strictness with the protocols and guidelines is long overdue. Just because we now have a new virus and it's kind of shut down the entire world doesn't mean that in pre-pandemic days there weren't bacteria and viruses in the aerosols, in the ops, and in the dental clinic, in general. So I think that we all need to understand that dental clinic is a place where you are at a high risk of contracting all kinds of bacteria and viruses, and those protocols need to be strict because it is a real threat, and you want to make sure that your patients and your staff are all protected. So now I want to say something else. I want to say that just because your regulator said that you can open June 1st or June 15th or whenever, doesn't mean you should. You should only, as a business owner, whether you're a denturist, independent hygienist, or a dentist, as an owner, you have to make the determination of, based on your specific conditions, the demographics of your patients, the access to PPE, the cost of all kinds of equipment and retrofitting of your office versus the amount of funds that you have available. And things like thoughts and concerns of your staff. All of these things need to be taken into consideration to even determine whether you should be opening. Obviously, capitalizing on what the team said earlier, you have to, if you decide that it's worth opening, you have to start planning ahead everything from getting the PPE, establishing the policies, creating all of the notifications throughout the office with the adhesive or not adhesive or whatever it is that you determine that is needed, through the equipment, through training your staff, through educating your patients of how the visit's going to look like. All of that requires preparation and thought with regards to what it looks like for your clinic. So I think if you are able to properly plan and explain to everyone what exactly is your thought process, people will have less fear of reopening. And I think that, to all of those owners who have just communicated their decisions to their staff without involving and engaging them in the decision-making process, you're making a huge mistake. And you will see this in your staff turnover, and you will see that in how committed and loyal your staff are as you reopen. I can tell you for sure that a lot of staff have extreme anxiety over speaking with their boss and sharing their concerns. And it's a big problem. And if you are an owner and you feel that no one has concerns because no one told you that they have concerns, then you are in denial. And these are strong words, but I highly recommend that you engage your team and you tell them, look, we're going to be reopening. I want to make sure you feel comfortable and address all of their concerns so they are a part of the solution and they're committed. And when they are speaking to your patients and sharing why the patient should feel comfortable, they actually believe that they should be comfortable, and they're not just saying it because that's what they have to say. Because if they're genuine, it shows, and the patient would know. So I think that everyone was overwhelmed and scared when the entire world shut down, because people thought that this is crazy, and I'm assuming no one has seen anything like this in their lifetime. But now that we are looking at reopening, I think there is a completely different level of fear or layer of fear added to the already existing anxiety. And what we need are mechanisms to deal with this. And the only mechanism that we know is conversation, information sharing, working together while addressing all of the concerns. And sometimes you get to a situation where you determine that it is not the right time to open, and you wait until the time is right, until you have all of the things you need when it makes sense. So I think that we all need to think about what makes sense to our business. We need to communicate it. We need to be very sober about the risks that we're having, and not taking into consideration just one research that came across our desks that says this is not a big deal. I think that if you personally are an advocate of the guidelines to be more evidence based, then potentially you're to some extent, delusional, because there is no evidence right now, and a lot of people are working to collect data and verify data to establish some sort of research and some sort of factual evidence that you can base some of the things are. So if you are surprised why Ontario is very strict, is because they don't know, they don't have any evidence, they don't have any factual information that is sufficient to make it more lenient. So they are making it stricter to protect everyone, because they don't know what should be. But they do know that the economy needs to open, otherwise it's going to be a huge disaster that is going to be something that's going to take generations to get out of. So I think that you need to understand, trust the people who are leading the organizations. They're facing a very difficult job in navigating this pandemic. You should question what they're saying and engage them to get explanations and clarifications, because that's going to help you in determining whether you're ready to open or not. But just opposing because you read some sort of an article that was sent to you over email or on social media, I don't know if that is, a legitimate reason to be upset with the people who are spending their time in trying to help you navigate this pandemic. So again, I'm gonna probably wrap up this monologue of mine, and otherwise we're gonna stay here through Saturday and Sunday. I don't want to turn it into anything that is negative. These types of things are really important for us to talk about. I think that at least we have the benefit of working from home. I know that for me personally, the weeks are flying by so fast that I absolutely cannot even believe that we're on Friday again. It's absolutely mind blowing to me. So I'm going to. Oh, actually, Patricia here is asking a question, so we're gonna try and answer that before we wrap up. We thought that we would put the costs in the PPE to our patients in our update letter. Is that a good idea? Well, that is a good question. So I'm gonna give my 2 cents on that, and any of the team members, will pitch what they think. So again, there's no such thing as good idea, bad idea. They're all ideas, and they might be good depending on your unique situation. So because I don't know a lot of the details of the clinic that you work in or the demographics around it, I'm gonna tell you my opinion in what cases it is a good idea and in what cases it's not a good idea. So if you're in an upscale community, you're charging usually over the fee guide, then you are probably treating patients that are used to paying premium for premium service. So if you have invested in equipment, in PPE, and you're returning to business, then that might not really affect anything if you charge them a premium. On the other hand, if you are working in an area that has challenges with access to care, then the higher the price that you charge for services, the less patients are going to come to get the treatment. So one of the issues here is that you're facing is, are you contributing to the challenge of access to care, which is a big deal in Canada, specifically in rural areas and northern communities, but also in urban areas in particular neighborhoods. So that's on a demographic level. From a clinic's perspective, I can tell you that it all depends on the margins of profit that you have and your relationship with the community, and how you want to be perceived by your community. Think about a situation where you implement a fee, but the clinic next door does not. Are you going to see patients who are going to go to a different clinic? I believe that you will, regardless of which community you live in. People, dental offices have seen an impact financially, but also the patients. And the patients are going to look for, a service provider that will provide, they can't really measure or compare services, but, patients just perceive that all dentists provide same services and same level of services. So they're gonna look, and they're gonna look at, we talked last week about online reviews. They're gonna look at that. They're gonna see what type of service, and when you are sending them a letter that says, because as you've seen in the media, the cost of protective equipment is skyrocketed, we're going to be implementing a fee for that. You might be opening the door for all of your patients to start Googling and seeing, which clinic around their home does not. So that might carry a huge impact with regards to patients. But again, these are just my thoughts, and like I said, there's no right or wrong answer. It depends on a lot of details with regards to your patients, the relationship, the patient experience, demographics, and a lot of other details here. So during downtown Toronto, and frustration is that dental companies have skyrocketed prices of PPE. Well, here's the thing. This is another something that I have to make a comment on, and I will let the rest of the team pitch in on this. But so there are two types of companies that sell PPE. Ones that have all of a sudden started selling PPE at skyrocketed pricing and are usually selling subpar quality. So I'm not going to refer to these companies because, well, they exist even in a non-pandemic situation, and they as far as I'm concerned, they have no right to even exist. But the normal companies that you deal with them day by day, that have been around in the industry for many years and provided great products and great services, they're raising the prices not because they're trying to take advantage of the situation, which is what I've seen a lot on social media, people complaining about that, price gouging and everything. These companies have paid a lot of money to get equipment, to just get the equipment. And then they paid a lot of money to get it shipped by plane versus by sea. That increases the cost of the PPE originally. So they have paid a lot of money for it. So they're not trying to increase their profits through charging you the high prices. They're trying to keep their business profitable with the high cost of even buying the PPE. So there's, like I said, there's a trickling effect in the supply chain, and price rising for certain things and prices dropping for other things. We've all seen the gas prices drop as you know the economy shut down. So some things their prices goes down, other things prices go up. As you know, we're going to evolve the situation. We're going to see if it's going to return to a normal price or if this is going to be our new reality. Um, but to answer the question, you know, it skyrocketed because everyone in the world wanted it. And you know, if you're a conspiracy theory, you know, enthusiast, then there's plenty of it going on online. But I think that the reality is, you know, it's the PP is here to stay for the pricing, and it's not going to go down probably for the next 3 to 6 months. And I've even seen this in Alberta because the ADA&C decided to purchase the PPE and to disperse it to the members itself, and they're encountering the same issue. If you want PPE, you have to pay for it. So again, that's just what's going to happen with regards to, you know, the location of your clinic in downtown Toronto. Again, it's going to depend on your patient base. If your patient base are families that are coming to downtown Toronto, that's one thing. If your target, you know, if your patient base is business people who want a quick in and out and are earning enough to pay for it, they might not really, you know, be put off with paying the additional fee, because they will see, like any patient's going to see that the costs have gone up when they go to their next dental visit. Like, it's a no-brainer. So I think that people would understand that it's reasonable, but again, it's all going to depend on a variety of variables that depend on your clinic. So I don't know, guys. Anything you want to add?
Yeah, actually, just if for consideration, I was just reading the RCDSO managing patient care, and something that it recommended is that the first appointment back with that patient, that would be more of like a screening appointment where you talk to them about the COVID screening, and then you have that opportunity to kind of share what has changed around the practice and kind of update them with the practice. That right there is a great opportunity that you can talk with them about those increased costs, rather than putting it in that letter and then releasing out to the patients. As you mentioned, Alex, there's a lot of variables at play. And then that does open the door for patients to start looking elsewhere for another clinic if they feel harmed in that way. I think one approach that could be a little beneficial, if that is something that you choose to do, is at that first initial meeting, and just talk with them about that increased cost and let them know what challenges are happening in the clinic right now, and that is maybe the reason why you've gone in with that decision. So that's just my 2 cents on the matter.
Good stuff. Jay, Noel, anything you guys want to mention?
No, I'm good.
Nope. You mentioned it already, Alex.
Sounds good. And I think we lost James somewhere along the line here, so all the names are scrambled again. But that's okay. Anyways, again, Patricia, thank you for the question. We hope we were able to, if not answer exactly, just give you some pointers to think about and try to figure out what that looks like, to you. in any event, again, thanks everyone for watching, whether you tuned in live or you're rewatching, not rewatching, watching a replay. We like doing this as kind of a wrap up to our week. That this week has been extremely busy, as we were mentioning. As always, feel free to reach out to us. We're here to help, whether you're a part of our family of clients or not yet a part of our family of clients. We're always here to help. So until next week, stay safe and don't have FORO, fear of reopening. And hopefully we meet here next week, and we'll chat a bit more about what's happening in the industry. Thanks a lot, and see you all next week.